welcome to our good evening, everyone. Welcome to our Zoom webinar about mental health strategies for parents raising children with autism. So for those who don't know me, my name is Sandrine Fotso. I am a mother of 4 beautiful children, one being on the spectrum. His name is Ethan. Ethan is now 12 years old. I'm also a wife. I am Executive Director of the Autism Blue Minds, which is a nonprofit autism organization with the mission to raise awareness and supporting individuals and family with autism. So for tonight's webinar, I am excited to present you with my beautiful crew. We have my co-host, Dr. Elise Jean. Welcome, Dr. Elise Jean.
Thank you so much. Pleasure as always.
We have Dr. Uluma Ukundai. Welcome, Dr. Uluma.
Thank you. It's a pleasure to be here.
Awesome. And then we have Michelle Petmi. Welcome, Michelle.
My God. Thank you. Hello, everyone.
Awesome. Thank you so much, guys, for accepting our invitation. We truly appreciate you. So without further ado, like I said, we're going to talk about mental health. And it's not uncommon for parents on autism, on the autistic children to experience high of stress, self-doubt, feeling of guilt. I'm one of them. And parenting any child comes with his challenges. And raising a child with autism can present additional complexity. So, however, you must change your thoughts because experimenting with different strategies, even if they fail, it's a good thing, to have happen as to you manage your child care. So nowadays, society is not always easy on parents who are raising children with special needs and often places unrealistic expectation on them. So parents can feel judged easily or misunderstood, leading to increased self-criticism and high expectation for themselves, feeling guilty if they believe they are falling short. Traditional parental roles are stereotyping, right? Can influence how parents perceive the effectiveness. Parents may struggle with feelings or not meeting the societal expectation of being a good parent. So I am very honored to have in this panel Dr. Oluma and Michelle Pedmi. They are both on the medical field of mental health. Dr. Uluma, she's a clinical director and part owner of Velox Medical and Mental Health Clinic. If you can introduce yourself to us, Dr. Uluma, please.
Yes, hello everybody. Dr. Uluma Ukundai, DNP, and like she rightly said, clinical director and part owner of Velox Medical Center and psychiatric or mental health. I have been a nurse practitioner for about 4 years now. My co-host, or Miss Michelle, I've worked with her for a couple years as well. So I mostly see pediatric. I see all life across the lifespan, but I mostly deal with pediatric psychiatry. So I have a lot of clients or patients from ages 5 through 19. And to the topic we're discussing, I do see the challenges that parents encounter while, with these children, with this population, you're almost treating the child and treating the parent as well. So basically, that's the introduction. Yes, I'm a psychiatric nurse practitioner with a doctorate degree now. Thank you for having me.
Oh, thank you so much. Good evening, Mrs. Michelle. With me, Michelle is a nurse practitioner in psych. Michelle, if you would love to introduce yourself, please.
Hi everyone, like the host said, Sandrine. My name is Michelle Petme, and I've been a nurse for several years now, like more than 2 decades. And like my colleague just said, Ms. Uloma, a nurse practitioner for the last 4 years. We are seeing patients in mental health across the lifespan is what we do on a daily basis. So for children, we definitely have patients on the spectrum, like variation. I mean, depending on the stage of the spectrum that they are, we see all of them. And we can also see the struggle that comes along with the deficit that those patients have in terms of like managing family values and parents struggling to be there for them. That's what we do on a daily basis, helping people to keep up with their mental health.
Awesome. Awesome, Michelle. Thank you so much for being here tonight.
Mhm.
We appreciate your time. Okay, like you said, Dr. Uluma, can you give us, please, some strategies how to manage stress, knowing that having children on the spectrum can, bring more stress on the parents. So is there any advice, I say like that you can, you can give us tonight?
Definitely. First of all, I'll say just acknowledge your feelings. Realize that it's hard enough to raise a child to start with, not much less of a child with special needs. So when you do feel stressed, when you do feel tired, when you feel incapable, just acknowledge it, accept the emotions, accept the frustration, and then seek help. Seek help in friends, support groups, um, family members, but most importantly, I think what we fail to realize sometimes is that it's okay to seek mental health from a professional just for the bare fact that we have kids that are on the spectrum. It takes a huge toll on the parents. So I'd advise every parent basically to seek counseling, seek some kind of counseling. It's okay to have a church family, to have, your immediate family, to have a good support system, good support network, but I think it is very important to also seek mental health on our behalf as we take our kids to, to their therapy sessions or to their, doctor's appointments and all that. We need to create the space for ourselves and feel that it is okay to also do that for ourselves. Um, Set realistic expectations. Some of, we already know, the limitations of the kids. Just take joy in the little steps they can make and set realistic expectations for yourself. Don't, overextend yourself there. I mean, you have this child and some people, like you said, you have 4 kids, you have 3 other kids. We also have to be very mindful about the other kids so they don't feel like they're being ignored and all the attention is going on one child. So it takes a lot of balancing and it's just a lot of mental work on the parents. So again, the most important thing I think is, get that support network, but definitely seek professional help. It's okay to do that. And please ignore my dogs.
Awesome. And you are perfectly right, because when I remember the time my son got diagnosed, at that age, he was 3 years. And like you said, like having a support group is really important. It's really important. And also taking care of you, taking care of yourself. Because like you said, you have other children and they don't have to feel ignored, they have to still feeling that you love them and you're not just the brother or the sister is not taking advantage of the situation. It's really important to explain that to them. And yeah, And that's very good. And what kind of advice can you give to the parents in terms of self-care practice? Like you have some example, because I remember myself, I was just going for a walk, sometimes just leave the house and have my me time was so beneficial. Is there any type of advice you can give us regarding self-care?
Definitely. Mindfulness, meditation, some people meditate. If you like music, take time out, create a little haven for yourself. The whole house, you can't, find a place in the house. It could be your bedroom, it could be a little study area that you set up, tidy just the way you want it. Always find a place to retreat to when you're in the house, even if it's 1 hour every day. Take that time, listen to music if you're somebody that likes music, listen to inspirational broadcasts, read your Bible, read your inspirational book, your Quran, whatever it is. But take that time, 1 hour, 2 hours. And the people in the house need to know as well. So if it's a spouse or an older child, put somebody else in charge for that time, but make it a routine. You must take that time every day. Another thing, like you said, you took walks, just get out of the house. Awesome. Some people are not very outdoorsy. Some people don't have that extra resource to really watch the child. So they kind of have to be in the vicinity, or they want to still be around the child, sort of. They want to be within, hearing shot of something going on, or somebody can reach them. In that case, I say have that little retreat that you go back to. But take a walk, go to the gym, especially those classes like group classes, yoga class,
Yeah.
body pump, cycling class, some kind of group activity where you meet other adults and just do your 1 hour, decompress before you come back home. If you're lucky enough, or if you have the ability to, do the gym and still have an extra hour or something to come home, relax, definitely take it. That would be my advice. But self-care is very important, because if you break down, there'll be nobody to take care of the child that you were doing all this for.
Yes, definitely.
Okay,
So,
to add to what Dr. Loma just said, we all know that autism itself is a very complex disease, right? It comes up with a lot of different angles in terms of stress level, feeling overwhelmed, feeling burnout, feeling guilty, like you said earlier. Therefore, the parent itself has to know what brings them joy, what makes them happy, okay? Because what works for A may not work for B. And then according to what works best for you, you need to find that little time where you can actually adjust your schedule to get that little joy of yours. It can be like you guys said earlier, taking a walk, reading a book, talking to somebody on the phone. But it's very important to be able to overcome those stress level and know that, okay, this is what will make me feel better. For a mother or father to be good in his mental health, he will have all the strength to be able to take care of the family. You will be like loaded to provide that care that your kids and your family need, in terms of like not yelling, not feeling easily frustrated, and not feeling angry all the time. Therefore, that diagnosis alone will bring you to get to know yourself in terms of like who I am, what is it that I like? Because it's definitely a grief moment just to know that there's a diagnosis. And why is it a grief? Because it's different according to what society has gave us, right? It's something that we're not used to, unless you actually have someone like a friend or a family member, or working with people that are mentally challenged, then you really don't understand what is going on with patient and family mental health during that time. So the diagnosis, while you're processing the diagnosis, that will make you learn about your own strength, and then your weaknesses, and your likes and dislikes. Because those uncomfortable moments, you will have to challenge them in order to find a good place for you to be able to feel good enough and provide that love to your kid. So it's very important to take the time to understand who we are as a person. And that can be with whatever makes you feel happy, and also like definitely checking for professional help.
Yes.
With.
Yes. And do you want to add something, Elise, from your own experience? I know you, the first time I met you, the story was just incredible. Do you want to add something to what they said?
Definitely what Michelle has shared. Can you guys can still hear me, correct?
Yes, yes.
Okay, very well. So one thing that was very important to me, and fortunately I realized it early on, was the power of praise. I practice it. That was my refuge. That was what made me just tune out, and that was what gave me strength. And I like to dance, so not say I'm a great dancer. I like to dance. So I'll put the praise on and I'll just rejoice, and I'll just at the same time with that practice gratitude. Because one thing that we forget is that one thing that has happened to us does not define us nor define our family. There are still a lot of good things that we have been blessed with. So
Yes.
if we start practicing gratitude, we kind of isolate that thing and make it understand that you do not define me. I have all these other things. Maybe another child who's not on the spectrum. Maybe I'm married and I have the support of my spouse. Maybe I have my mom, my mother-in-law, my sisters. I have this network of people that are there that I can call. I'm not by myself. And also the friends. So practicing gratitude made me be able to count all my blessings and then look at that thing. So that helped me minimize the pressure that the diagnosis brought on. Because when it hits you, it's like heaven is falling. You
I
just
know.
feel like it's the end of the world.
Mm-hmm.
But if you practice gratitude, you'll be able to just squish that thing in a little ball and have it there in the little corner, and then realize that it's just one little thing. And the more you minimize it, the stronger you become, and the more you can even process now what are your strengths, what are your weaknesses. You have time now to actually do now to think about yourself, because autism can just overwhelm you. When you hear about it, when you hear how it affects you, it can just overwhelm you. But if you are able to just narrow it down to one little thing about what's going on in your whole life and the life of your family, it gives you room to think about how to tackle it better. And like I said, to me, praise was the thing. I praise, 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 praise. I'm sure my walls know how to praise by now.
And that's a good point, Elise, because like you said, it gave you that strength to know yourself. So that's very important, because like embracing the diagnosis help you actually identify who you are as a person. And once you are able to do that, then you can conquer those struggles easily. Okay,
Yeah.
so that's the point, because then you will know your strength and your weakness. Like I always said, it comes through that.
Yeah.
And maybe autism will just make you realize like some other struggle that you've been having for a long time that you never dealt with. You were able to deal with them, but now it makes it harder. So you have to conquer them in order to be able. So very important to know
Yeah.
who you are as a person and know what brings you joy, because sometimes we don't know. We may
Yeah.
take other people's joy and transfer it to us, but it doesn't actually bring us joy. So that's something you want to be careful with as well.
Definitely. Thank you
And
so much.
the story of others are not your own. So you don't rely on others people's story, because you can make your own story by addressing your issue accordingly to how they present to you. So, and because
I testify.
yeah,
Yeah.
your child, whatever type of behavior he's having, is not actually what the other one is having, even though it's almost the same, but they don't respond the same. Therefore, if one has respond one way, you need to find what works best for your child, and then go through that child level at that moment and be able to communicate with that child and look far away to understand that he did understand this easily. That's what you're going to start using for him. It's not because somebody has used the process and it has worked that it will per se work for your child as well. So be very patient and to practice that and listen and hear and open your eyes to see everything that's going on, and praise, reward, and again, gratitude all the time. Those words.
Great. So you were talking, Michelle, about behaviors. And, I remember those days with difficulty behaviors with my son Ethan. So I wanted to ask you, you and Dr. Oluma, what would be the techniques that you guys recommend for de-escalating difficult situation? Because sometimes it's very embarrassing knowing that you are in the store or you just go for walk and the kid is having a really, really bad temper tantrum and you see everybody just staring at you like that, what are the advices that you guys, you can give to parents?
First off, I mean, thank goodness the people are getting more aware about autism and other neurological, disorders, as well as even the mental health problems we have today. People are getting more aware. There's really not much you can do about people's perspective or how people feel, but I will say nowadays, almost everybody has somebody in their family that is dealing with a child with autism. So,
Sadly.
first of all, yeah, don't be embarrassed about it. Don't It is what it is. That child could be having a seizure. I mean, it is as legitimate as any other medical or mental health disease. If they were having an asthma attack, you won't be embarrassed. You will be giving them the inhaler and treating them. So if they have a meltdown in the store, they're probably overstimulated. They start to do, what they do. Just give them time in de-escalating the situation. Don't make a big deal of it. Don't find the flame. Let them do their thing. Let them have their meltdown. Talk to them in a low tone, whatever you know the level your child or the child understands to what extent. So at that point, if they're having a meltdown in the store, you probably know what the trigger was. So first off, I'll say start with not getting them triggered to start with. If you know the child, every autistic child I know doesn't like loud noises. They don't like, there's certain things they don't like. So don't take them to the circus, for example. He will have a meltdown in the circus. So if they're in a store that was quiet, this is something he normally tolerates, but all of a sudden today he's having a meltdown, he's closing his ears, take him away from the environment. If he's screaming in the store because he wants something, he cannot get it. Like I said before, the level of mental understanding of the child. Talk to them. Okay, I can see you're upset. What do you want? I will do this for you if you do this. If you stop misbehaving, we can do this. No more car rides. That one toy they like, whatever it is, their comfort blanket, give it to them. But the main thing is, you can afford, with all the issues we already have, we cannot afford to be feeling embarrassed for other people or on their behalf. Speak slowly to the child. Don't criticize them too harshly. Don't raise your voice. Don't stimulate them any further than they are stimulated already. And just try to take them away from that environment. Empower them. Empower them to speak back to you. What is it you want? And if they tell you home or food or toy, then just go ahead and do it. Like I said, it is as legitimate or as organic as any other illness he could be having. He could be having a hypoglycemia. He could be having whatever it is. So he's having an autistic breakdown. That's just what it is. Everybody else is just going to have to deal.
Yes, definitely. Yes.
Yeah, to add with what Uloma said, what can I say? Like be calm. Like most likely we know that we have like children with different disability going on. Like let's say if he's in the store and having a meltdown, of course, it already makes you feel nervous. It's making you feel like angry yourself. So if you get it, the more angry you get, the more because it feels like you don't understand why he's crying and he does not understand why you're getting upset as well. So you guys are on the point where nobody understand each other. You don't understand him, he doesn't understand you. So the more you're getting angry or trying to like be agitated, he will be more agitated. So my advice would be just be calm enough, get down to his level and try just to communicate with him, like try to see what will help him calm down. And if like it happened that you have to leave, then yes, because overstimulation is usually one of the number one trigger. You will have to like stop the activity, maybe give him a break and then probably come back, but try to remain calm as possible. Okay? Just try to remain calm.
All right, awesome. I just wanted to jump on something, Michelle. Do you, I mean, as far as medication, have you, I know I remember with Ethan when I went and talked to his pediatrician about his behavior, he was not sitting still. He was very, very agitated. And I remember, I mean, it was like 6 years ago, the pediatrician recommends medication. And at that time, I didn't want to put it on medication. I just wanted to start with ABA therapy as soon as I can because, I knew I did my research and I knew it would be the best for my son, so I didn't want it to put him on medication. So now that I have you both on the panel tonight, what do you think about medication and the medication management for behavior strategy? Do you think it's a good thing or you think it depends on each child? Because some parents would tell you, for example, oh, I rather start him on medication than having therapy, ABA therapy. So I guess that's my question. What do you guys think about that?
It is going to vary from child to child, and ABA therapy can still go hand in hand with medication. I think it's a quality of life issue. I know people that have kids that are on the spectrum, and some of them are very social. They're just maybe a little bit socially awkward, and you won't even know they have autism. And I have others that the behaviors are just, very obvious, and they can hardly go about and do anything that their peers can do. So in those situations, for example, recently we had trick or treat this past
Mm-hmm.
Halloween. And I'm in a new neighborhood, so some kids, came around, they're trick-or-treating, and I could see a parent like hanging in the back with a kid. And I kept saying, "No, let him come up front," but she's like holding on tight to him. And I said, "That's okay." She still wouldn't let him go. He can't have candy. I thought, "Yeah, but at least let him come get it." As soon as she left that kid, it took off. I had to run, after him to go, grab him, help her grab him. And she was so embarrassed. And I said, "You know what?" I said, "It's okay. I'm a nurse practitioner. I see this a lot." So we got talking. Now we talk every now and then. She texts me, same situation. He does go for some therapy, not ABA, but she doesn't want him on any medicine. She doesn't want him on this. She thinks therapy is going to be bad. She thinks medicine is bad. What is interesting though is the kid is also diabetic because he's a young kid, but he's big. His diet, he just eats, I think, as a comfort thing. She just keeps feeding him. So I was telling her, I said, "Well, you have no problems giving him his insulin, because his blood sugar is high. So why do we have such a problem with medicating him for these behaviors?" And I think that's where most of the problems, come from, because we see this kid, you can objectively see the blood sugar is high. So you'll find you're going to get the insulin. But when the child is running away, this is a 12-year-old child, is running away, you don't see that as a danger. You don't see that. You see it as something you can talk to him or hold him, restrain him. That is not a good quality of life, if you ask me. So in those situations, I would definitely put the child on some kind of medicine so they can have some kind of life, some kind of, fun. There was no fun in that kid going for trick or treat with his peers. And I know that as soon after that run episode he did, I know the mom matched him back home. So he's probably going to be home with dad, and all the other kids are out trick or treating, when some kind of medicine would have at least calmed him down a little bit, that he can at least, the little joys whatever you can get. So in that regard, I would say I'm all for medicine, for anything. I'm all for medicine, counseling, ABA. I've seen ABA do phenomenal things. I've seen kids in like 3 years, they come back to me, I don't even know them anymore. They're like fine, as you know, basically fine. And they're just on therapy. And I've seen some that go to therapy and, you know, I just can't push medications. You can't push it on the parents. And I'm just thinking, they would do a lot better if they had this medicine working hand in hand. They'll be more receptive. You know, they'll be more open to learning these techniques and all these skills and, you know, coping skills that they are being taught in therapy. Half the time without medication, you know, the kids, they don't get it. So to answer your question, I advocate for medication. If there's a provider you trust, a healthcare provider that is suggesting medication, you know your child, you know, they suggest medication, I'll say, look through it, look at the side effects of the medicine, discuss it with them, and definitely, I'll say, you know, do it. For therapy, I think every child who has autism, every child who has ADHD, every child, if possible, I think in this current climate, should be getting counseling, if possible.
Okay. Thank you so much, Dr. Uluma. Thank you. Do you want to add something, Michelle?
Oh, yeah, sure. In terms of like medicating the child or not medicating the child, that's there's no right or wrong answer in regards to that. However, depending on each children and each family, they should they can do different things in the lifespan of the child. Let's say if I go back, let's say to your case with Ethan, once Ethan got diagnosed, the first thing you were on top of it, you started therapy very early, right? You started therapy very early. And he was already socially very involved. Like he's like a very social person as a kid, even though he was having all this behavior, he was still socially, always wanted to be around. You know, you will have moments up and down. And then therapy was able to actually help him like redirect his thought and be able to like behave appropriately according to all the situation. And remember, you were there all the time to take care of that. However, other family don't have that privilege, like because like ABA therapy and mental health, which is already a very stigma, you know, like where people are not like understanding or don't even want to see what is going on with it. They might be afraid. Like you have some family who doesn't like therapy, like ABA, they don't like it. Why? Because they think that ABA will force the children to do what the children doesn't want to do. Okay, so like ABA will force you to calm yourself and sit down in front of a lot of people when you actually want to scream or play, right? That's ABA because they will do it routinely, repetitively until the child is able to get the behavior to what the society has proven right. So you actually have parents who say, no, I don't want no ABA just because of that. So the vision are very different. However, now, if your child is able to manage your expectation according to the world expectation and the family expectation on a daily basis, then yes, you don't need any medication. But if you still continue to have difficulty to be able to get the child to your expectation, then at one point you may need some type of help. Okay. It's either, it might be medication or it's also diet. We know that on ABL, on child on the spectrum, diet has a lot to do with that. So it's nutrition, is therapy, is like love, is communication. Because the family that actually gets to the point where they have that diagnosis, if there's no love, the child can tell. When they start fighting, the parents start fighting, the child can tell. If you're feeding your kid with donut, Pepsi, soda, all that for dinner, and then you expect the child to sleep, it won't happen. Okay? So you do have parents who come and be like, oh, my son is not able to sleep at night. He won't even eat. Okay, simple question. What did your son eat right before dinner? Oh, he got French fries, and he would get a cup of Coke every night, or orange soda, whatever. You can tell big sugar, you can tell diet is very not regulated. Of course, that child, because he's already like on the spectrum with all the highs, will have difficulty to fall asleep. And if once she start reducing the diet or helping better manage that kid diet, it has changed some of his sleep already, which has improved some of his behavior. However, they may still need some type of medication. So depending on what is going on, yes, you might need medication. If the parents are able to manage with therapy and what they do at home, they can still do it. So it's hand on hand.
Let me chime in because I could not wait for someone to say diet. I could not wait for someone to say diet.
Yeah,
And
I know.
I'm gonna be the bad cop right here. You all just have to bear with me because
that's okay.
that excuse that some of us parents have. My child only eats this. My child only wants that. My child can only eat this. The question that I always have for that parent, when did that child take your credit card and go to the grocery store to buy those things that you are claiming that they only like? You have allowed them to taste those things. Now, this is all their mouth, the tongue, the taste buds know, and now they are hooked to it, and you are in this vicious cycle of them only wanting that wrong thing. If you realize that you have a child on the spectrum who's going to be bringing challenges with regards to diet, that's the time where you become the diet police and you clean up the house so that what they're exposed to is mostly healthy things. And then somehow you might have a problem where, okay, it's healthy, but it's textural, but at least it's healthier than having them have donuts and Coke for dinner. Because once they get that, you are stuck. They only want those bad things. Once their taste buds get whatever they get, they like, you are stuck with it. I've been very, very blessed. And people might say, well, you are a unique case, and that's why you're speaking like that. My daughter, Idrea, is 7. She was put on the spectrum when she was 4. She has never taken, I don't even know what ABA therapy is except for having read it online. I've never taken her for any therapy. She's never had any sort of therapy. She's never had any medication per se to treat any symptoms related to autism or autism, the disorder. Not because, yes, I was reluctant. I didn't want her to be on medication and all that, but I was very, very blessed to understand the importance of diet early on. By the time she was 4.5, 5, I was already blessed to have the right information and to understand that diet was so critical and could really help turn things around. I'm not going to say that just making sure that she eats the right thing and she gets that her gut health is taken care of is what caused the miracle to take place. No, I give God all the glory. But I also know that that particular move made me see things almost like magic. I started to see things change, and she went from a child that would only eat crunchy things. If whatever we made was not a crunchy texture, forget about it. She wasn't eating, so it was a struggle. But after we fixed the diet and we were able to introduce her and to help her get her gut clean, we like clockwork, we started seeing her eat the things that normal people, the rest of us, eat again. She could not eat rice. She cannot eat things with wet textures. She cannot eat meat again, chicken again, fish again. And it's the diet is very important. We have to own that there is something that we also have to do as parents. We cannot just say the child wanted that. You bought it. I'm sorry.
That's true. That's true. I wanted to give the floor to Sylvie. Sylvie raised her hand. Yes, Sylvie.
Yeah, thank you. Thank you, Sandrine, and thank you to all the panelists. I really appreciate everything that you guys have been saying so far. I just wanted to make a comment on what everybody has said about the diet, about the medication. So I'm a parent of a child who's now 19, and she's on the spectrum. just like Dr. Lee said early on, we were very blessed that when she got diagnosed with autism, that we went on the study to understand what autism was. So from day one, we changed her diet. And it has been basically a very healthy diet since she was diagnosed. That was 15 years ago. So it has been a long time that her diet is what we think it should be. So she has a very healthy gut. We thank God for that. But at the same time, Megan was diagnosed with level 3 autism. Megan is severely autistic, which means that behaviorally it has been very challenging. Dr. Uloma mentioned the quality of life early on. With a child with severe autism or profound autism, how the CDC call it now, you understand that you have a very poor quality of life when you have a child like that. For years, I was very reluctant. We were very reluctant to put her on medication. Again, the reason why is because first, we have a lot of cultural belief behind medication. And second, the side effect of medication. So I'm a behavior analyst, so I work with a lot of clients that are on medication. And when I would see my client and I would see the side effect of their medication, I'll be like, no, I cannot make my child go through this. Honestly, I'm pretty sure God is going to do a miracle because, I firmly believe that, God do answer prayers. I just have to be patient. Now, when my daughter was 17 years old, things got worse because, as Dr. Uloma said it earlier, if you're dealing with a 12-year-old running out of the house, it's not a big deal, right? But when you start having an adult, hitting babies out in the store or running away, like right in front of the street when there are cars, you're putting not just her in danger, but you're putting the rest of society in danger. And that is a big problem. So even though I was still very reluctant, now being in the field and understanding the danger that I'm, exposing her to and exposing the rest of society to, I finally was forced, I have to say that, to put her on medication. So she's taking antipsychotic medication right now. It's been a year, and I will not tell you how that quality of life has changed in a good way for her first, for us second, and for society third. And I'm just, when she started medication, I was like, I was a behavior analyst. I've been a behavior analyst for years. Everything that I knew that I needed to do for her, I tried my best. But still struggling with managing her behavior. So finally, when we put her on medication, we started seeing great results. I'm not going to say that I have regret, but I'm grateful that I think that I did everything that I needed to do for her before getting in that stage. And once I get into that stage, I realized that when they say sometimes for some people, medication work in combination of all the services is true. So it's on a case-by-case basis, but people should really try to find what works best for them, what works for them. So that's what I wanted to add. And I said that it's very important. And now let me just also mention something. Yes, I was very reluctant for many reasons. As I said, I'm also exposed to people that have that. Yes, we did have a lot of side effects. Megan, in 3 months, put almost 40 pounds on. Yeah, that was devastating for me because I knew that may happen. But when I saw that she was doing well behaviorally, I was willing to do what I needed to do to keep her on medication. I wanted her to stay on medication, but also make sure that we are not exposing her to other disorder. For example, she was already pre-diabetic. When she started putting all the weight on, her psychiatrist said, we have to stop this because it's going to create other issues that we don't want to solve. And I said, you know what? We're going to solve that issue. What did I do? We started increasing her activities. So she started doing many other stuff. And we stay in the same diet, but we reduce the portions, right? So instead of eating the amount of food that she used to eat before, we reduce it and we got her more engaged in things that she's doing. And we did actually change another thing in the morning. In the morning now, she's actually getting, instead of getting gluten-free, organic, things, in the morning, actually now, she gets only a salad with salad. She gets carrot, celery, and almonds with a little bit of chia seed for omega-3 and all that. That's it. And you will not believe this. She lost even more than the 40 pounds that she puts on. So I'm just so grateful, and I'm sharing that to encourage a parent here and saying that, God will answer prayers. It may require that you do a lot of things to get there, and just make sure that you go through the process and seek professional help. Dr. Olomo insisted on that early on, and I think this is very important. And support group, just like a group here. And I thank Sandrine again for this platform. Seek professional help, seek support group, ask questions. It's not the end of the world. Thank you.
Thank you.
Amen.
Sylvie. That was very nice.
Beautiful. Thank you so
Thank you
much.
so much.
Does somebody else wanted to react in the audience? Somebody wanted to share an experience with us? Please don't be shy. If you wanted to talk, raise your hands, and yeah, we'd love to listen to you.
We're all in this together.
Yeah,
Like Dr. Oluma said, either you have a child who has autism or you know somebody who has a child who has autism. That's the reality of America right now. I'm sorry.
Of
So
the
we are all
world,
in
not
this
America,
together.
Elise. That's the fortunately, it's everywhere. It's everywhere.
Everywhere.
Yeah.
All right. If no question, nobody has a
I can
question.
ask a question if no one else is going. I actually have a question for Dr. Oloma. So you said earlier that it's important for people to seek professional help. What do you think is a barrier, especially in our community, for people to seek professional help, whether it's in the mental health, psychology, psychiatry or psychology? So what do you think is the issue, and how do you think we can help solve that issue, or at least help improve things in our
That's a
community?
great question. Wonderful question,
That
Sylvie.
is an awesome question, and I just don't want to go down a rabbit hole. But I'm going to say the major thing I've seen in my professional and even personal life has been religion. It's been people seeking for professional help, and you're going to meet your clergyman. I know God works. I believe in God, but I also believe that God put doctors, scientists, and everybody in place to help treat these illnesses or whatever it is that we go through. Like I said before, for the past 3 years, I've only really done child psychiatry, just children I see, and it's like pulling tooth to tell, to get parents to take children to seek mental health. Or when I consult with them, I don't get any benefits from the pharmaceutical company, whether they start on any medications or not. But like I said, with the kid that was doing the trick-or-treating, the kid already takes insulin. So why are you so resistant to not necessarily an antipsychotic? It could just be a mood stabilizer. It could be anything, but if that child develops seizures, we're good with giving them seizure medicine. So we just have this thing, this block against giving anything that we think is going to alter their behavior. But the behavior is the problem. The behavior is the problem we have with autism. So that part, there's some kind of, I don't get that part. But again, in dealing with people, you have somebody who's open-minded, they want to take the child to go see a professional. I've seen kids 30 years old, autistic, never seen a provider before, never gone to see a professional. They don't get any kind of, I'm sorry, Mara. They don't get any kind of therapy. They don't get any kind of medications. And they are level 3. Like we know there's children that need some kind of support. There's some that need a little bit. But those that are flight risks, they are a risk to the environment, a risk to themselves. They are not really verbal, nothing. Or you've never taken them anywhere before because we have somebody who's praying for them, or we have one auntie that has said, just stay there, something is going to happen. And you have another child on the other side, hand that was like that 4 or 5 years ago, has been going for therapy, is on medicine, fully functional. You only know that child ever had a problem if you see them in some kind of settings. You just notice they're a little bit socially awkward. So it just, I think in our culture, we still have that big resistance. We don't want anything mental health. I think we don't like medicine to start with. We don't have a culture of, seeking professional help for medical things. I think there's some kind of superstition. There's stereotyping, and there's denial. There's denial. I have seen children diagnosed. I have even diagnosed, I've helped my psychiatrist diagnose autism, and they say, never. It is not possible. We don't have that in our family. This child has all the symptoms. Just start treatment, but they just choose to be in denial. So, so I think to your question, that is our biggest problem is our cultural beliefs, is the people we choose to seek this help from. The woman, there's a know-all, there's somebody that knows it all, that, people just listen to, and then you choose not to listen to a professional. Just go to a professional. I mean, you can always even try 2, 3 professionals. You can get referral. I have people come to me, I tell them this is what it is. Oh, you know what? I need you to refer me to a neurologist. I'm like, gladly, especially with children. You don't even want to misdiagnose somebody's child. You don't want to mess the life of a child up by giving any kind of wrong diagnosis. So typically, even if I diagnose anything, I'm going to say I want a psychologist to follow through. And I send them to the psychologist. They go to their neurologist. They go to the pediatrician. But it's always us, the Africans, that come back and feel that those 6, 7 specialties don't know what they're saying, but this person in this church or this uncle here or this person says this, and we're going to stick to that. That is the biggest problem I think we have in our culture. I think that for me.
on that.
Yeah, and to add to that, to our culture was actually taking you away from treatment or from what we're supposed to do. We also go with the shame. That's probably from our culture as well. The shame and the stigma, the looks of other people, what are they going to say? Because you will see parents like worrying about how they will be seen or viewed by the peers, then how they will take care of the kid. That's another issue. So, and also sometimes we don't know that, okay, the same way your health insurance that you're actually using to go see your pediatrician, you can actually use that same health insurance to see a mental health professional. So that's very important, that especially if you do have a child on the spectrum, when you're choosing or picking your benefit, like your health insurance, you want to make sure you have mental health services included, like some type of psychotherapy that you can get from a therapy, and anything that you can get from that, because that's one point that people don't really look at. Okay, I'm going to go see my pediatrician, how much I'm going to pay for that. And how about mental health services? You need that. You have to know that mental health services are part of your health insurance. So you can always go to your provider. Okay, you can go to counselors with your insurance card. You can go everywhere, and they have community clinic where they actually are specialized to help families and children on the spectrum. So you have to look around your community, like type it up and see what you can get out of it. Okay, so that's very important. And because sometimes financial, in terms of like ABA therapy, depending on the state that you are, it's not always it's easily affordable. It's very expensive. That's another thing. Or you may have 3 to 4 hours of ABA per week, or I don't know how they do that. And then it's not going to be beneficial enough for your need, the need of the kid. Therefore, you have to try to do that yourself. So I would say those are the different barriers that we have. Okay, so reach out to your community.
If I can.
Yeah, go ahead, Elise.
I'm going to summarize everything that we have said with one word: ignorance.
Yes, I wanted to talk
Yeah, we
about
try not to
that.
use the
No, we
those
have to
words
be
as
honest.
professional. Therefore,
No, it's
No,
not a bad word.
no,
Let's take away
I
the
agree.
stigma around that word. It's not a bad word.
I
Ignorance is
agree.
not an insult. It means
Yeah,
I don't know.
yeah,
Ignorance is not an insult. There is
yeah,
also a stigma around that word.
yeah, that
When someone
stigma
said,
is
I'm
very,
ignorant,
yeah,
they're
the
like, what do
stigma
you mean
is a
you're ignorant?
very hard one.
No.
It's a heavy one even to
Yes.
carry along, because first of all, we all know autism on top of everything. Mental health is already a big stigma to start with. And then
Yes.
add autism on top of
Yes.
it. Okay.
Yes. We perish, and this is, excuse me, I'm going to have to quote my scriptures. We perish for lack of knowledge, which means we perish because we are ignorant.
yeah,
So the fear that we have from dealing with what we deal with autism is deeply rooted in ignorance. Because if you understand, like you guys said, that when your child is blood glucose level is elevated, that means I need to replenish the insulin. Well, when the neurotoxin in the brain are also imbalanced, I need to give something that's going to help balance it out. Hello?
Yeah, Elise, that's
So
why
it's
it's
like,
very important for all
it's
of us
lack
here,
of
not only for,
knowledge.
yeah, it's very important for all of us, not only talking about our autistic children, that mental health is as equal as physical
To
health.
physical
If
health.
you can decide to make some changes in your life in terms of, like, let's say what like most of the women here struggle with, I would say struggle with like weight, right? What do you do when you feel that, oh, I think I've gained some weight, I need to lose weight? What will you do? You start changing your diet. You exercise a little bit more, okay? And you can actually push and go through, do your blood work, make sure that's the same way you need to conquer mental health. The same way. Like when you feel down, we all have moments where we are down, where we feel really down, depressed. It can be life circumstances. It can be all our daily struggle. It can be a lot of stuff, not only your key diagnosis, right? Because this is just one add-on on top of
just
everything
one
going on with your life. So you need to be able at one point to, the way that you're taking care of your physical health, try to take care of your mental health the same way. It's like parallel.
Yes.
And then you feel you will be in a such
in.
better place.
Yes. And to bring it back in circle, when I mentioned the diet earlier, and I said, okay, with my daughter, I was fortunate that just changing her diet and make sure that her gut health was in point. This is because, fortunately for me, because my background is also in nursing, I've been a nurse for 18 years, I understood that whatever her brain needs to function needs to be fed. Whatever her brain needs to get better, she needs to get it. And if her gut is not functioning properly, no matter what I'm feeding her, her brain will not be able to receive what she needs. So I went the natural way. I went with diet to help her brain get what she needed. But if it had not worked, I would still have had to go now on the next step. Okay, I did what I could with the gut. The gut didn't work. Her body is still not able to absorb what the brain needs. Well, how can I now get supplementation to make sure she gets what she needs? When we are low on iron, we have no problem going to the drugstore and purchasing
get the
some
iron
iron
pill.
pills
There you go.
when
That's a good
the
example.
spinach or whatever is not working. So it's okay to try the natural things first, but ignorance has limited us because we just have this blindfold that we work with, and we just like, oh no, if I do that. And this thing about worrying about what other people think. No, God gave you that child because he knew that you could take care of that child. He gave you that child. He didn't give your neighbor. He gave you that child because he knew when the fight was going to come, you were going to wear the gloves and do what you got to do. So we have to stop worrying about what others, how we are viewed, what they think. When I used to go with Andrea before her behavior changed to the mall, and she's tall for her age. So you look at her, you would think that she was much older. She'll just throw herself on the floor while we are walking down the mall to go to maybe to a store or another. I was not that parent that was going to be like, oh, I'm sorry. No, no, no. I looked at her and I looked at the people looking at me like we were all looking at someone else's child. Like, what are you looking at? Mind your own business. No, don't, your issues are not going to define me. The way you feel about how my baby, who you think is much older, is acting because you don't know what she's going through. I'm not going to let that affect me. So it is something that we so have to work on. And because we have that, we cater so much to what our loved ones, our family member, our relative, our in-laws, don't get me started, are thinking or are feeling about our situation. It takes us away from actually fighting and advocating better for our babies.
Elise, just to hear you talking, we can tell that you
Excuse
have
me,
already reached
Michelle.
that stage where you accept it and you walk through your condition. But remember, we still have parents who are not there yet, and we have to help them getting there. Therefore, for us, like Dr. Uloma and myself, we have to be gentle in terms of like how to make them get there. That will be our job. And that's why at the beginning we talk about learning yourself, learning your strength and your weakness, and be able to conquer them. That's when you get to where you are. Okay.
Yes.
You're
I
I
already
want
was here
there,
2 years
that's
ago,
for
trust
sure.
me.
Elise, let's say it is lack of knowledge. I think you maybe
Yeah.
You
better
had it right, yes.
it will seem better by saying it's a lack of knowledge. Dr. Oluma, you wanted to say something, right? But you got cut off.
I was just going to chime in about the, getting support groups, being around people. And
Yeah.
I commend you for this that you've put together. I think it's a great start. Want to say, and I'll employ anybody else too on the panel, if we can get one or two clergy people on this panel the next time. Let's see, because most of my challenges with my parents and their kids come from what some clergy person has said, or something with their religion or something. So if we can get a clergyman, woman, anybody on this panel to at least hear their take and see where they're getting their experience and how much success they've had using
Mhm.
their technique, or what they're telling parents that are making them so resistant to any kind of medication or any kind of treatment for
I
their children. That
know.
would be phenomenal.
This is a great suggestion because the problem that I love to raise awareness about autism, and I've been doing this for more than 4 years now. And I've noticed all the time in Houston, only in Houston, there is a lot of, the Cameroonian people with dealing with autism. But every time when I do awareness, they don't show up.
They don't.
They don't
They don't.
show up. So I don't, sometimes I pray for that. I pray God, touch their heart. I don't know. I had comments like, Sandrine, you are so brave. How come you can, go out like that and be vulnerable, tell people about I'm a proud mother of a son on the autism.
Yeah.
I just believe, like you said, it's either deny or lack of knowledge or I don't know whatever, I mean, what we can say about it, but I wish, I'm not going to stop doing that, because I'm passionate about raising awareness. Hopefully one day I send the invitation to more than 50%. But look,
Yeah.
and I know they have children on the spectrum.
I
So I
also
don't
sent
understand. Sometimes I'm like,
invitations.
I don't want to judge them.
Yeah,
Everybody's dealing with their own, life.
true.
But I'm praying that God touch their heart
And
because
that's
we
why,
are giving valuable
yeah,
information for free. You guys
and
are
that's
taking your
why I say
time.
go to the source. I think the source is that congregation, wherever they're getting there. Is that church or is that clergyman? Is that whoever? And I think I'll take it upon myself too to ask because I invited about 12 people that are 6 of them had kids on the spectrum. My 3 friends that I've joined now, one of them doesn't have any kids, one has 4 kids, they're all healthy, and the third one doesn't has 1 kid. So all the people I expected to join on
Mhm.
that will benefit,
Yeah,
here.
Yeah.
And okay, a Sunday evening, they're probably on the phone with their clergyman, casting and binding or doing something. And, at the end of the day, it's not as beneficial. So I will take it upon myself, and I think I will even call them out on this next time, and I'll tell them, okay, who do you talk to? Who's telling you how to deal with this kid and that? And if they tell me it's that person, I'm going to have you send the invite to that person specifically so they can come here and tell us their tactics and what they're doing. And if it's helpful or if it's working, then let's all know. Let's all benefit from it.
Please make
yeah,
sure I'm on that panel.
That and start taking.
No, she will. That's for
Please make
sure.
sure. I don't want to miss that day.
She
yes.
This is
will.
what
She
I'm
will
going.
make
This is
sure.
this is why I'm going to say this, Dr. Oluma. I've been a nurse, yes, but my degree is actually in theology.
Yeah.
My doctorate degree is in theology, and I cannot wait to speak with that clergy person who will be telling someone that yes, all you have to do is cast and bind, because there is a reason why God sent doctors and nurses. And I'm a proud nurse. Like I said, I've been a nurse for 18 years, and there is a balance. When you have a headache, you don't just cast and bind. You're looking for Motrin and Tylenol. That's the first reaction that you have. And when you swallow the Motrin and the Tylenol and it doesn't work, that's when you start wondering, okay, is there more? Am I having a stroke? Am I having this? Is my pressure up? Is this and that and the other? Now you start considering all the other things. And when we have checked all the boxes and nothing seems to be out of order, that's when you are allowed to go on the spiritual battle. That's when you are allowed to now wear your armor and try to fight whatever you need to fight. But first of all, there are things. If you get a cut in the kitchen while using a knife, you don't start casting and binding for the blood to stop flowing. That blood is going to run out of you. You better find something to apply pressure, find a band-aid,
Yeah.
find a way to stop that blood. Otherwise, no casting and binding will stop that blood. So we need to find balance. So please make sure that that day, I don't care where I am on the planet, I better be on that show.
No, there's more into it, guys. There's still more because the understanding of the mental health care, we don't have it as much. That's
No.
why it's still
No.
very a stereotype, like Uloma said earlier. You know, it's still it's a stigma. That's why we have to be able to like unveil that stigma out of people for them to be able to, you know, be ready to accept what is going on and change, because the change will start with them first before they can actually go share it with others.
Mhm. Yeah.
That's why we are having these platforms. And like you mentioned, the people that come are the ones that don't even have the problem. It's like,
No.
okay, you even refuse knowledge. And you guys, I know you guys don't like my word, but you refuse the knowledge. You refuse knowledge. You're
No,
going to pay
Elise.
for it. Yeah, the second part of that verse is that because you have rejected my knowledge, I'm going to reject your children. Go read it. Hosea 4:6-7.
Hopefully,
Yeah.
hopefully next webinar, they will, we will have like many people with, I mean, actually parents with kids or, children on the spectrum joining. But was already wonderful. We are going to the end because we've been talking for more than 1 hour now. Before I let you guys go, Dr. Uluma and Michelle, is there any type of resources that you guys can share with us, books, articles, something that might help parents or that are here tonight or who will be watching the webinar later?
Any kind
If
of resources
yes,
to help the parents like manage stress and manage the kids. Well, besides the points we made earlier, I fear when I refer people to go read stuff unless I have specific books, because I have patients that check Dr. Google and come back to me and
yes.
tell me, WebMD said this or Dr. Google said that and all that. I'll just say, seek professional help. You have a child on the spectrum. Life is tough enough on its own. Being a mother in this present climate is tough. Single mother, you know, both parents raising kids, raising a child on the spectrum is so much stress. Just go out there. Your healthcare covers it. And if you, like Michelle said earlier, if you have, when you're picking your insurance, make sure you pick one that has coverage for mental health. I don't think every parent at this point really should even check in on a counselor or a therapist every now and then, be it with your marriage, with your children. We're trying the cultural conflicts with the way we were raised and how we're raising kids now with everything else going on. We try to think we're the only ones raising our children and putting all these thoughts in their head and growing them the way we want to grow them. But they're out there in school with kids that are raised by two daddies, two mommies, some are gay, some are this. So there's so much these kids are dealing with, and they can't bring home because we're who we are. We're African parents. So they can't tell you about, their emotions, their sexuality, what they're exposed to. I mean, the number of kids that I see with drug issues, not even marijuana, like Xanax, that are their parents' medications or that they're getting from somewhere. And their parents are like totally oblivious of what's going on with these children. So basically, just seek help. But by the time you talk to a therapist or a counselor and you say your poor children is what's stressing you, you're thinking about their future, they will be the ones to open your eyes to let you know that, well, those are your children, they're gang. What is going on with them now is weed, is this, or is that, is that, because they have no clue. So for that alone, go seek the help, talk to somebody. Then if you have a child with special needs, like we said, fine, get your own space, retreat. Not all of us are outdoors people, I'm not, I love music. put on your music 1 hour, decompress 1 hour a day, whatever time you have. Take it away from that child, preserve your mental health, really.
Awesome. You want to add something, Michelle?
Yes, if take care of your mental health, that's your number one. Because especially if you do have a child on the spectrum or with any type of disability, whatever you have a new diagnosis, that's gonna like disrupt the usual way the family's dynamic goes. You need to sit down and think about it and see how you're going to tackle that diagnosis. Therefore, if it's going to bring a lot of challenges within your life, you need to make sure to sit down and think about yourself. How am I going to do this? And that will be where you gonna have to work on yourself in terms know what you're good at and know what you're not good at. Seek help. Seek community help in terms of that diagnosis, like autism. Find a group, a support system, a group where you can be part of, listen to what others are going through. If it may give you some type of comfort or not feeling alone, be part of that group. Even if you don't have to be there, maybe you can come later. If you're not strong enough to come to this type of platform, you can come later and listen to it, but be part of it. They probably have a WhatsApp page or a social media page where you can ask questions anonymously and somebody can give you some answer. And I'm around your community, Google, Dr. Google, and find some area that can provide you with free help, like counseling, therapy for you, for your family. And know that you're not alone in that. If prayer helps you, keep praying, keep doing what you have to do, but at the same time, seek for professional help and take care of yourself.
Awesome.
Yeah.
And I wanted to add, we have a support group on WhatsApp. If anyone wanted to join, please contact me. My phone number 248-212-4803, and I will be glad to add you. We also have all our platforms on TikTok, Instagram, Facebook, LinkedIn. We are even we have a YouTube channel. We are talking about autism all the time. Like I said, I am passionate about raising awareness, and I think I'm going to do it all my life. So please, theautismbluemind.org is our website. Go there, you will find many ways you can help, or you can interact and see what we are doing. theautismblueminds.org.
What is WB?
WW.
My French.
Messing with her, Michelle.
www.theautismbluemind.org. So yes, we are going to the end. I wanted to thank you both. Dr. Oluma, Mrs. Michelle Petmi, thank you so much. Thank you for your time. Thank you for your wonderful advice, expertise. We really appreciate you. I want to shout out a big thank you to my co-host, Dr. Elise. And before
A pleasure, as always. And those two ladies, thank you. You were, thank you. We needed to hear all that. Yes, we needed to hear all that.
Great. So it's going to be recorded and it's going to be archived in our website or also on YouTube. So please feel free to go there and then you can watch the whole webinar of tonight. So if there is no other question, we're going to say bye-bye.
All right.
Bye.
Thank you so much. Thank you so much. I see
Thank you, everyone.
There, Sylvie, William, Cici, Lena,
King David.
And then Felicia. Thank you all so much for joining us tonight. Really appreciate it. Yeah. Until we see you next webinar.
Thank you, Sandy.
Stay tuned. It's going to be awesome. Bye.
Thank you, William, for letting me meet.
Thank you so much, Sandrine. Thank you. Désolée pour le retard.
Thank you, Sandrine. It was really great.
William, did you get her number? You wanted to join the platform. Were you able to write her number down?
No, so I was about to call you.
Okay.
I'm gonna send it to you. I'll
Okay.
send you her number, and then she'll connect you and add you to the platform. Okay?
Yeah,
do.
please do. Please do.
Yes, I'm gonna do it right now, Sandrine.
Yes.
So expect a text from me.
Thank you.
Thank you, Jacqueline. I saw Jacqueline also. Thank you for joining us. I hope I didn't forget anybody. Yes. Thank you so much, you all.
Sandrine, it was really great.
Awesome, Sissy. I'm glad you were able to join.
Oh, yes, on time. Now on time, like 5-10 minutes late. It was really
I
great.
know.
I like it.
No problem.
Yeah, thank you.
Thank you. Thank you.
Thank you, everyone.
We talk to you next. Bye.